Hi, I'm Raphael, the athletic trainer, and today our safety training is going to be over ergonomics and biomechanics and injury prevention introduction. Now, what is ergonomics? It's defined as fitting the workplace to the user's needs. Now, ergonomics aims to reduce discomfort, increase efficiency, and increase productivity. It's all about finding the proper position for you and adjusting the workplace to you. Now, biomechanics in the workplace is basically the study of body movement, including how muscles and bones, tendons and ligaments work together to produce movement. Now, good posture can greatly decrease strain on the lower back, and like frequent bending, twisting, lifting, pulling, and pushing are all risk factors for back injuries. And back injuries are the most common injury in the workplace. Now, neutral posture or neutral position is one of the fundamental things that we need to look at in trying to make sure we're putting the less stress on our back as possible. So we want to make sure our chest is up, our head is up, our back is straight. This puts less stress on our back. We want to avoid awkward postures like bending forward or extending back or twisting or lateral bending. This puts more stress and strain on the back. We want to try to make sure we stay in neutral posture as much as possible. Now, for every body part, you have a neutral posture. So for your shoulder, it's right down by your side, and it puts less stress on your shoulder. Now, once you get into moving your arm up or moving it back or out to the side, that's considered an awkward posture, and it puts more stress and strain on your shoulder. Now, this is good sitting posture, making sure your back is straight, everything is at 90 degrees, and it puts less strain on your back and on your hips. Now, examples of bad posture is like slouching forward. This puts more pressure through your neck, puts more stress and strain on those traps. So we want to practice good posture for both sitting and standing to best avoid injury as much as possible. Now, you want to try to stay in the power zone. The power zone for lifting is close to the body between your mid-thigh and mid-chest, just like the strike zone in baseball. This is where you're the strongest body position when you're lifting or moving an object. We want to try to stay in this green zone and stay out the red zone because it puts more pressure and strain in the red zone on your shoulders, on your back, every part of your body. So make sure you try to stay in this power zone when working. Now, there are common workplace injuries like your backs, shoulders, and feet. We'll look at the back first. The back is made up of 32 bones called vertebrae. You have 7 cervical, 12 thoracic, and 5 lumbar pelvic bones. Now, in between each backbone, there's a disc or a cushion that provides shock absorption. Now, let's look at some low back injuries. Back muscle strains are very common. Also, having a herniated or slipped disc. In between those vertebrae are disc, and it's just like a jelly-filled donut. And so once you have that jelly come out of that disc, that's considered a herniated disc. So we want to try to protect these discs as much as possible. Now, you want to avoid poor posture. You don't want to work too far, too low from a load. You want to make sure you have your back supported if you are sitting. You don't want to be reaching up or looking up too high. It puts more stress and strain on that neck and also on your shoulders if you're lifting something up. So make sure we try to avoid these poor postures. Now, here's an example of what started before, where the worker had to take the paper off that high table on the left, and they had to put it down on the pallet. So that required a lot of bending. Now, having this palletizer, it helps bring up that load so they don't have to bend down as far, and it should be right there in that power zone. So we want to make sure that we're looking at all these types of tasks and seeing if we can make it better for you. Another poor posture to avoid, hunched over. When we can lift that table up, it brings you up into that nice power zone so you're not slouching over and putting more stress on your back and on your neck. You also want to make sure that you're avoiding poor posture at home as well, because it does spill over into the workplace. Lifting do's and don'ts, you want to make sure you're lifting heavy objects as a team. You don't want to be lifting heavy loads alone. This puts more stress and strain on your back and on your neck and on your legs. So make sure you're using a team lift so everybody exerts less effort. You don't want to be twisting when you're lifting. You want to make sure you turn with your legs. You don't want that axial load and that compression on those discs when you twist. You want to turn your whole body with the load. You don't want to use your back when you're picking up an object. You want to make sure you're using those stronger muscles in your legs to lift that object up. And you make sure you use the equipment that we have provided for you so you're not putting unnecessary stress on your body. Now let's look at the shoulder. Common injuries are rotator cuff injuries. You can avoid rotator cuff injuries by avoiding repetitive work and awkward postures. You want to make sure you're using proper shoulder blade mechanics. You want to try and stay in that neutral posture or that power zone. Rotator cuff impingement is when the bursa within your shoulder is compressed. You don't have a lot of space in that shoulder, and once everything starts to inflame, either the muscles in there or the bursa, everything you do reaching up overhead compresses and pinches in that area, causing pain. Early symptoms of soft tissue injuries are pain. Your body is telling you something, so make sure you're listening to your body. You have limited range of motion. You're not able to reach up as high as you used to. You may have popping or snapping feelings. You have swelling in the area, bruising, or muscle weakness, or muscle cramping. These are all early symptoms that we need to recognize and be able to get help when these things happen before it gets worse. Now, repetitive motion. It's a big reason people develop shoulder injuries is they repeat awkward positions with this overhead motion. So we want to make sure we're not doing anything like this and avoiding awkward positions. Now, looking at foot injury prevention, common injuries are plantar fasciitis. What that is pain on the bottom or heel of your foot. You may feel it when you wake up in the morning on the bottom, and then it kind of goes away once you get moving around. This can easily be taken care of by calf stretching. There's some other things you can do as well, but try to stretch out those calves. Another common injuries are twisted ankle or having heel pain or Achilles tendon pain. So make sure you're getting these things taken care of, or come talk to me. You want to make sure you have proper footwear. The tread on the bottom of your shoe is not too worn and it's in good shape. You want to make sure you're wearing the proper shoe for the surface that you're on. You want to make sure you have good arch support, because if you don't, that can lead to that plantar fasciitis. Now, what's very important is your frequent daily stretching or your pre-shift warm-ups. Now, the goal of pre-shift warm-up is to increase your flexibility. It's going to warm up that body, increase the blood flow, and increase your heart rate. It's going to help loosen the body and prepare your body for work. Now, you want to focus on large groups of muscles like your hamstrings, and also the small groups like your wrist muscles as well if you are doing a lot of repetitive motion. You want to emphasize stretching throughout the day. Now, this is the 1-minute power break that you can be doing at your workstation, and it's recommended to do every 40 to 60 minutes. That should be posted around your area. This is going to help reduce tension and fatigue. Do not attempt any activity you have been instructed not to do by your physician. Now, poor flexibility causes a whole bunch of problems. It can cause other muscles to work harder and can lead to a strain. Also, if you have lack of motion or mobility, can lead to injury. Hamstring tightness is one of the #1 causes for back pain. If you have tight hamstrings, it puts your hips in a bad position and puts more stress on that back. So make sure you're trying to have a good flexibility routine. Stretching is a vital part of everybody's daily routine. We also have pre-shift warm-ups that is here to help warm up your body before work. You want to make sure you do not hold your breath and breathe normally. Don't bounce with any of these movements. You want to stop any stretch if you have any pain or discomfort, and make sure you see me if you have any questions or any modifications that you want. All these exercises can be done at a different way if you are having any issues with them. If you have any questions about ergonomics or certain tasks, make sure you talk to a safety committee member or safety management, or come find me. Remember to work smart and be safe.